right, I'm recording now with Dr. Sanjeev Balakrishnan, who is a metabolic practitioner and GP from Perth, Western Australia. Sanjeev, thank you for coming on the podcast.
Thanks, Max. Thanks for having me.
Great. Well, can we start with a little bit of background about yourself and your journey throughout medicine?
Yeah, okay, sure. Um, I've been a doctor now for just over 22 years. I graduated in the year 2000. I had plans to become a surgeon, but that did not materialize, and I decided to do family medicine, which I completed, and I completed my training in Singapore. I moved to Perth about 8, 9 years ago, and I've been doing this metabolic health medicine for the last 5 years, helping my patients improve their metabolic health. But improving my own metabolic health, I have been doing this for almost 13, 14 years.
And like a lot of other doctors, you had your own, I guess, personal health journey that began you on the path towards implementing a lifestyle type approach. So can you tell us a little bit about that, and then how you discovered low carbohydrate diets and ketogenic diets and the rest?
Yeah. So about 14, 15 years ago, I was doing what every typical Asian was doing, consuming a diet high in carbohydrates and having like, so my staple diet was like rice 3 times a day. And what I didn't realize is that I was putting my metabolic health in jeopardy. So I just woke up one morning and realized I had a large waist circumference and I had some man boobs. And that was a wake up call for me. And so I decided to follow the advice that I was giving out to my patients, like, cutting out the fat in my diet, eating less, exercising more, and avoiding fatty food. And yeah, what is fatty, right? So there's no clear definition there, but so I did all the right things which I thought I was doing, and all I did was just keep increasing in size, right? So what happened was, from white rice, I went to consuming brown rice and thought, yeah, brown rice should be better. Then when brown rice didn't work, I went to black rice, and yeah, nothing was working for me. And while all this was happening to me personally, I was going to work and working in endocrinology unit and learning, because it was part of my training. I was training, and I was learning how to manage people with type 2 diabetes. And one morning I had this big scare. I realized that someday I was going to be a diabetic and I was going to see patients like me, and whatever I'm doing is not going to work, and I'm just going to get worse, and I'm going to, like, one day be with taking several medications, and I might even be on insulin. So that really frightened the hell out of me. And I said to myself, look, there must be a better way. So I went online trying to search for answers, and I stumbled across, and till this very day, I have no idea how I stumbled across the Diet Doctor website. And it was a very, very small website back then with quite little information, but important information. And I read what Dr. Andreas Enfeldt was saying, and I said, wait a minute, this is making a lot of sense. This is making a lot of sense, and I just did it. So I just did whatever he advised. So I was just avoiding carbohydrates in my diet, building the courage to start having fat in my diet, and I started to see changes, right? And feeling safe to consume fat again was a big one for me. So, because I always thought eating fat was going to make me fat, right? But this time, eating fat is making me lose weight. So, I had to build a lot of courage to start
Yeah.
having animal fat again, and
Mm.
butter again, and ghee. And I could see that my waist circumference was starting to become smaller. My man boobs were starting to disappear. My pants were becoming loose. And later on, about a few months after that, again, I have no idea how I came across Dr. Jason Fong. So he and he's him advocating the intermittent fasting. So I brought that into my plan as well. And so with a low carbohydrate diet, ketogenic diet, low carbohydrate ketogenic diet with intermittent fasting worked like magic.
Yeah. So
So
rocket fuel.
yeah,
I mean,
yeah.
that's a fantastic story, and I think it really touches on the point that people have to go through things themselves, and many doctors who we see are leading the charge in terms of lifestyle medicine and low carbohydrate therapies had a scare with metabolic dysfunction, and they had weight problems, or they had a health issue that prompted their own soul searching. And as you describe yourself, when implementing the plan or the management option that we're taught at medical school, and throughout our training, we found that it didn't work. And that was the trigger to discovering a lifestyle intervention that did work. So I mean, it's an interesting story, but I think it's not unique in many ways.
Yes. So it's really silly, because uh, I think one of the great books out there written on this subject matter is the Obesity Code by Dr. Jason Fong. And when I first read that book, I just felt so stupid. I felt so stupid because I know everything that's mentioned in there, right? Everything in there is simple biochemistry. And I'm thinking to myself, why did I forget this? How did I forget this? Right? Because it's not new. It's things we learned, but I think that whole influence that fat is bad for you, ketosis is bad for you. Somehow, that whole idea narrative, overrides what we learn in med school. I mean, if you look at the books, it's there,
Yes,
right?
yeah,
How
yeah. That's it.
how yeah.
I mean, I just want to make the point, and the evidence is there, the science is there, everything is already in place. It's simply in between that scientific understanding the physiology and the biochemistry,
Mm,
the distance between that and the advice we give to our patients, in that gap is influence and shaping of the
mm.
narrative, shaping of guidelines, shaping of treatment plans. And that is that point where a lot of people end up being told advice that isn't helpful for them. But go on, please.
Yeah. And yeah, so that's why I said I felt so silly reading the book, because these are things that I learned but I didn't know. Okay, learned and didn't know, or maybe forgotten. And so I find that book very empowering. So with all this information at hand, I saw the transformation on myself. I was still a bit hesitant to teach all this to my patients. I was rather hesitant, and it was only after I met Dr. Gary Fetke, who's Dr. Gary Fetke has this famous saying, once you see the evidence, you can't unsee it, and he's the one who encouraged me, to like teach my patients how they can improve their metabolic health. So yeah,
And and sorry for listeners who aren't aware of Dr. Gary Fettke, he's a orthopedic surgeon from Tasmania, Australia, and he went through quite a drawn out procedure proceeding with the health regulatory body in Australia, after being lodged multiple complaints for inappropriately reversing his patient's diabetes with low carbohydrate and ketogenic diets. So he's a real, I guess, trailblazer in the movement for metabolic medicine, not only in Australia but but worldwide.
Yeah, I certainly agree with you. He's been a trailblazer. In fact, I told him he's the beacon of this low carb metabolic lifestyle in Australia. And yeah, so ever since that's how I got into this. And in the last 5 years, that's what I've been doing, helping my patients improve their metabolic health, and we've had a lot of great successes.
Yeah, and I really want to get your opinion or your idea, your conception of what is metabolic health, because a lot of people and believe that it's simply just weight. They're told in every they're told to conflate or equate health with weight specifically, without distinction for where that weight is or the type of adipose tissue and the location. So, can you tell people or give people an idea of what is metabolic health, and what do we look for in terms of metabolic ill health?
Yeah, Max, that's a very interesting point. And I just had one patient yesterday who came in and said, "Look, I don't think I'm too fat for my height, and but I know I'm metabolically unhealthy." I said, "Yeah, because your numbers show, and we'll explain what the numbers are." And he was not too fussed about his weight, and I agreed. But what he had was a large waist circumference. Yeah, so although his weight was well within the range for his height, appropriate weight range for his height, I said that waist circumference that you have is one of the key indicators that you're metabolically unhealthy, and that's what we are going to focus on, not so much on your weight. So yeah, so waist circumference is a good indicator, but apart from that, is having a good blood pressure and having a good triglyceride HDL ratio, and having your blood sugar levels under control. These are all indicators of metabolic health. So usually, if you see someone has a large waist circumference, you will also notice that their blood pressure is slightly elevated. Their blood sugar levels may fall in the pre-diabetic range, above 5.7, and their triglycerides are usually elevated, a lot higher than their HDL cholesterol. So yeah, and of course, fasting insulin. So invariably, when all these numbers are not normal, uh, their insulin levels will also be elevated. Yeah, so it's looking at all these parameters together to determine how healthy or not someone is from a metabolic point of view.
Yeah, yeah, and these five factors were the original constellation of features, specifically waist circumference, raised waist circumference, high triglycerides, low HCl, high blood glucose, and high blood pressure. They were the original five factors that were described by, I believe it was Dr. Reven, when he coined the term Syndrome X, which was metabolic syndrome. And those constellation of factors put people at high risk of cardiovascular disease, developing diabetes, stroke, all the constellation of the lifestyle
Mm,
factors, lifestyle diseases and chronic diseases that we know about today.
that's right.
So that, as you say, that they have to be taken in together in totality, and each of them provide an insight into what's going on and the metabolic dysfunction that's happening in the body. I really like how you mentioned that there's not only those five factors that you look at when you're seeing a patient, perhaps for the first time in your clinic, and fasting insulin is a really important test. So, what is fasting insulin, and why is it so valuable, and how what is it telling us?
For me, I mean, in my practice, I like to use the fasting insulin because I think it gives us a look into like a window into the future. Because sometimes you could have somebody who has all they have all the right numbers, but when you do their fasting insulin, it's elevated. Now, it may not be sky high, but it's elevated, and that's like telling us there's still something in their lifestyle or diet that needs to be fixed. and because I like to focus on prevention. Um, and so fasting insulin can, it's to me, it's really like a window into the future of things to come. And because when I see patients who come to me with all this information, they know what they need to do and they've been doing it. And yeah, they're all quite lean and they've got all the good numbers. When you check their fasting insulin, it's invariably under 6. And so okay, right, this person here is indeed metabolically healthy, and they are either at very low risk or no risk of metabolic conditions.
Yeah.
So fasting insulin can be a very good marker
Yeah.
for what's to come.
Yeah. And for people out there, the insulin is secreted by your pancreas. It's a hormone that's made by the pancreas, and it's key in helping maintain a stable and appropriate blood sugar level. So the way I like to think about fasting insulin is, if it's elevated, it's like you're running your car, you're revving your car. You're like an idle.
Mm,
You're not moving the vehicle, but you're revving the pedal, and the engine's turning over, and it's burning fuel. And that is the analogy for the body kind of working harder. It has to secrete more insulin to maintain a normal blood glucose level, because the
yes,
body is insulin resistant. And the key point is that the blood sugar glucose level will often be normal, but it's normal because one reason is because your body is secreting more insulin. So it's a great insight into, as you said, the future and an early predictor. Because as you said, we're about preventative health. It's about detecting
yes.
metabolic dysfunction before it manifests as type 2 diabetes. So I really like that one, and I think I heard a rebuttal, and the reason why fasting insulin isn't measured widespread today is because often clinicians will say, "Oh, it's really variable. It's a really variable assay. It can go up and down day to day." What do you say to that, and what would you say in response?
No, I disagree with that because see, what I normally do at work is I give specific instructions to my patients on how many hours to fast, and then we do the testing, and
Yeah,
perhaps to add value to the fasting insulin assay, we also have to simultaneously find out what exactly is the fasting glucose. So that
mm,
fasting glucose to fasting insulin ratio is a really good predictor on the metabolic status of the person. And so because often you get someone who has a normal blood glucose, fasting blood glucose level, but their insulin levels are rather high, and that's very telling. That like you said, I know that the car engine is revving higher to maintain that normal blood glucose levels, and over time your insulin levels are going to get higher and higher and higher, and your pancreas is getting more and more burnt out. Finally, when your blood glucose starts rising, you're in trouble.
yeah,
But
yeah,
the trouble began several years ago,
yeah.
right? So doing both the insulin and glucose levels are very informative.
Yeah, and that's called a craft test. If we do an oral glucose test, like we give you 75 grams of glucose, and we measure
Yeah.
the insulin level and the glucose at the beginning at fasting, and then it may be 30 minutes, 1 hour, 2 hours, and up to 5 hours if you depending on how far you want to go. But the response and looking at the blood glucose and the insulin level paired together in response to that glucose challenge is
Yes.
immensely powerful for detecting insulin resistance and prediabetes. So
Yes.
that's fantastic, and also very important for something like diagnosis of PCOS, polycystic ovarian syndrome, in particularly, which is insulin resistance in young women, and the hallmark or one of the hallmarks of that disease is insulin resistance. So again, measuring a fasting insulin is not only for the older diabetic or overweight, um, gentleman in his 50s. It's for everyone. It's a universal marker of metabolic
Yes.
health. And what else? What
Yes.
what are some other? Sorry, go on.
Now, I was going to say it's a very good tool
Mm.
to help ladies with PCOS, with polycystic ovarian syndrome,
Mm.
because I think a lot of there are many ladies out there who have PCOS, and what's usually not always, but usually missing from the treatment is the dietary intervention. The dietary intervention that's often forgotten or missed. And these are ladies who would be given metformin. So we are giving them metformin to address that metabolic dysfunction. And but over time we have been conditioned to think that metformin is the treatment for PCOS, but it's not treatment. Treatment is improving their diet, getting them to reduce the carbohydrate intake, making them insulin sensitive once more. And once you start doing that, you see all the features of PCOS reversing.
Reversed,
The
yeah.
hyperpigmentation, the excessive hair, the body weight, and most of my patients report their periods becoming regular again.
Yeah, yeah, it's immensely powerful, and I get, as you say, fertility is a big sign or outcome of normalization of all the metabolic dysfunction. It commonly comes back very quickly with what once that insulin level comes down and metabolic health is returned. I really like your analogy of or your statement about metformin not being the cure of this disease. And I had a chat to Dr. Penny Figtree, another GP, and she said something which was, I tell my patients, you can wake up in the morning and you can have wheat bix, which is a wheat cereal here in Australia, and insulin, or you can have an omelette. So I mean, the
Yes,
same thing goes with PCOS. You can have your bowl of rice or your big bowl of pasta and metformin, or you can have a steak,
yes,
you can have some mince,
yes,
and that is
yes,
really kind of sums up the treatment of metabolic disease and what I believe personally is the misguided approach to treating metabolic disease
yes.
in modern medicine is that we're going straight to drug therapy without first giving effective
Hmm.
lifestyle and dietary advice.
Yes, Max, I'll tell you a funny story. I had this patient once who could not explain why his blood sugars were high every morning, and he refused to believe that Weet-Bix was making his blood sugar levels high. And this is a guy who would have like 6 biscuits of Weet-Bix every morning with milk and with some honey. And he refused to believe that it was Weet-Bix because he thought Weet-Bix is a healthy breakfast. I said, okay, fine, fine. Okay, here's what you're going to do, right? Tomorrow, so I gave him a glucometer. I gave him a glucometer from the clinic. I said, tomorrow morning, have your 6 week Weet-Bix like how you normally do. And 2 hours later, check your blood sugar levels. And the next day, have some bacon and eggs, and then check your blood sugar levels again 2 hours after that. And when he came back, he said, "I just don't believe it that Weet-Bix has so much of sugar."
Yeah,
Right.
yeah,
So something like that was his wake up call. Like, oh, I've got to change this. I've got to change this because
yeah,
the other thing with that story is he thought he had to have all those carbohydrates because he was on all those medications.
yeah.
So what we had to let him learn is that if he were to cut back on his carbohydrates, he won't have to depend on that many medications.
Yeah, yeah, and I mean, it's simple. The metabolism of wheat bix, which is long chain carbohydrate, complex carbohydrate, simply when digested gets cut up into glucose, into individual
Yes.
glucose molecules. So so even though people believe they're making a healthy choice by ingesting so-called complex low GI carbs, the real world effect on their metabolism is frequently a massive glucose rise in blood glucose, and which is contributing to their metabolic dysfunction. On the point of consuming carbohydrates for the diabetic drugs, I mean, that is a common kind of circular type of reasoning that you see in the treatment of gestational diabetes, type 2 diabetes, insulin resistance. It's, well, now you're on insulin, or now you're on this sulfonylurea medication. Make sure you have enough carbohydrate. And it's a bizarrely circular and frustratingly absurd approach, in my opinion, to a disease that can be cured with
Yes,
some fasting and some low carbohydrate medicine.
yes,
So, oh God,
that's right. I've every time I get a new patient who's on insulin, right, and I ask them, what's the one thing you want out of this consult, or what's the one thing you want to change about your diabetes? They often say, I want to stop my insulin. And then I look at their food diary and I ask them, why are you consuming this and that and this and all this high carb diet? And the answer is, because I'm on insulin. Because I'm on insulin, I've got to eat all this sugary stuff.
yeah,
And so what usually wakes them up is when I tell them these are the foods that are feeding your insulin need.
yeah,
Right? You're feeding your insulin. You are feeding your insulin. You're not feeding
yeah,
yourself.
yeah, 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 yeah.
Yeah.
It's
So because mm. so
I mean, go on, go on, go on.
once they understand that, it's so easy to help them reduce and cut back on their insulin requirement.
Mm.
And I've had quite a number of patients who've been able to successfully stop using their insulin. They are on tablets, but they were able to come off their insulin.
Yeah, yeah, yeah. I mean, and it's so common. We see that all the time. Deprescription of quite large doses of insulin in a matter of days. I mean, it's not like it's taking a month to come off insulin. It's simply you reduce the carbohydrate load in the diet, and what is 2 days, one day? What's the time frame that you're seeing in your patients?
Oh, I always see. So there's no one fixed rule. It all depends on
Mm.
how comfortable the patient is doing it. So the lower their insulin requirements, the easier it is. The greatest success story I had was an Italian gentleman on 88 units of insulin, and he took about, if I'm not mistaken, about 12 to 14 months to come off his insulin, because he was initially quite apprehensive about doing it. So he did it very gradually. So like he cut back on his insulin needs like by 2 units every week. And so I did not push him, and he wanted to do it on his terms. But guess what? After 12 to 14 months, he's no longer on insulin. In fact, he went further and came off all his other medications. Now he's only on metformin.
Wow, powerful.
And yeah, very powerful. And this is one of the old school patients. He carries his book like a ledger, and he's written all his
Yeah,
insulin requirements, dates, and blood tests. So he's carrying his own charts, and if you look at his chart, you can see how from 88 units later it became zero. About
yeah,
I think 12, about 14 months later.
yeah. Yeah, and incredible that you can reduce that patients, if they want to, can come off so many what are effectively lifelong medications for blood pressure, for diabetes,
Yes.
all these unnecessary prescriptions. It's almost like a those ads, pharmaceutical reps, hate this one trick, like, because you imagine the cost saving that's happening for the patient and
Mm.
for the healthcare system when you can deprescribe 4, 5, 6 medications that would otherwise be
Yes.
paid for by our healthcare system. I also want to make the point in response to that, the way that you treated your patient with the wheat bix, and that is the power of experimentation. And at the end of the day, we have guidelines that treat all our patients basically, in aggregate. These are aggregated, treatment guidelines. But what in fact everyone needs is an individualized system that's based particularly on their individual response, and empowering someone with something like blood glucose monitoring or a continuous glucose monitor allows someone to understand and see what is the effect of this particular dish this meal on my own blood sugar, and they can see for
Yes.
themselves that the wheat bix or the low GI pasta is sending their blood sugar up into the stratosphere. So I really encourage
Yes.
that for patients to really think about yourself as an individual and really work on yourself, whether it's in how you feel or something is more objective like your blood sugars.
Yes, because everybody is unique, everybody is different, and everybody has a different level of understanding.
Yeah.
Everybody has a different level of comfort on how much they
Mm.
would do, and the idea here is also not to scare them away. Is For me, it's all about giving them options, just giving them
Mm.
options, because many people are under the impression that if they have diabetes, they must be on medications. They must be treated with medicines and insulin. Telling them it's not necessarily so, often is quite empowering to them, because I always thought I needed medicines. No, this is what you can do on your own to improve your blood sugar levels. So you don't need that many medications. You might need them, but not with your current, not this many. And eventually, you might be able to come off them. So, I mean, I don't know about the patients you see, Max, but it will be most likely like mine. But people don't like taking medicines.
Not at all. And yeah, like you said, this is about patient-centered care in a true sense of the word, not in a lip service, cliched kind of way. It is truly about giving people options and empowering them to make the best choice and the most appropriate choice for them at their stage of life. And some will not decide not to take up the option, and some will prefer to
Yes,
continue injecting insulin. And that's their path. That they're free to choose that. And that's fine. But for the number of people that want to not be on medications, then this is an option. And I think as doctors, it's our duty to provide that accurate information and counselling about this lifestyle approach.
yes, certainly.
Mm. Can you talk a little bit? We talked about fasting insulin. I really like that test. There might be some doctors listening to this podcast. What are another tests, particularly perhaps in the liver function, that is an indicator to you of metabolic dysfunction?
So, yes, liver function test is another quite a revealing test. And in the liver function assay, I usually like to look at what their ALT readings and gamma GT readings are. And it's quite funny because every lab will give you a different normal range, and almost always the range is quite wide also. But what I like to my the numbers I go for is any ALT and GGT reading above 20 is trouble. So I can't remember where I read, but apparently, like many years ago, ALT and GGT levels under 20 were considered normal, and as over time, that range just became wider and wider and wider, and so now you can get a reading of, like, I think, depending on the lab, you can get a reading in like in 40,
40, yeah,
in the range of 40s,
yeah,
and still be considered normal,
not
right?
normal,
And
yeah,
yeah, but no, yes, no, you can get a reading in the 40s, and it will not, it will fall in that range and be considered normal. But
yeah,
these are the people, if you get their ultrasound scan done, it will show presence of mild fatty liver disease,
yeah, yeah,
right? So when it comes to the ALT and gamma GT, I use 20 as my cutoff,
yeah.
and so that's another good test to do.
Yeah. And what that speaks to is this idea of establishing a reference range or establishing a normal based on an unhealthy population. So I mean,
Yes,
if you take a whole cohort of people and they are metabolically unwell to some degree, and then you plot a normal distribution of that cohort, you're getting a skewed idea of what should be healthy. And
Yes.
there's so depending on what study you read, the proportion of metabolically unwell people in America, for example, where most of the cohorts are, is anywhere from 80 to 90% metabolically unwell. So if you take a cohort and you're making a reference range, which is a normal limit of a lab test, your normal is going to be completely skewed, and that's exactly what you've just
Yeah.
mentioned, Sanjeev. So it's interesting how metabolic doctors practicing this way often have a much more strict and a much more specific reference range for a range of tests. And as you said, ALT ideally below 20, fasting insulin, ideally under 5, maybe closer, maybe 3. It's definitely not 20.
Yeah, certainly not.
Yeah, yeah, yeah. So and I really like it. So we've added fasting insulin, we've added liver function like ALT. These are just more kind of tools. And do you see urate commonly? I mean, urate is frequently a marker of fructose metabolism, or people eating too much fructose and sugar sweetened beverages. Do you see raised urate commonly?
Oh, yes, we see that quite often, but
Mm.
I don't do it routinely. But I normally do it when I'm trying to help my patient who supposedly has gout to
Mm.
improve their condition, because they would have a slightly elevated uric acid level. And
Mm.
again, instead of addressing that problem, they'll be given allopurinol,
Yeah,
and they'll be on it like for like 10, 15, 20 years,
yeah,
and it's not helping because they continue to get gout. The uric acid levels are still high because they have
yeah,
not addressed the key reason that's
yeah.
triggering their gout.
Yeah, yeah, and isn't it? It's almost beautiful in its design of this current approach, where we've got a pharmaceutical intervention for each deranged biochemical marker. Um, as Dr. Rob Sabo said, all these markers are simply just windows into the same room of metabolic dysfunction. But
Mm.
as you can talk, as we've talked about, you can choose to take a medication to address each individual one: a blood pressure medication, a uric acid lowering medication, blood sugar lowering medication, or you can resolve the underlying cause, which is the metabolic dysfunction, and suddenly the need for medication evaporates.
Yes, Max, because I think both, the general public and doctors in general, we have been all conditioned to think there's a pill for every ill. I remember when I was growing up, I had a couple of friends, who would like have headaches, and for whatever reason, and refuse to take medications. They would like go and drink more water, or they'll just go have some rest. And I'll be quick to pop 2 pills. Okay, headache gone. Yeah, and it's all conditioning. Today I realized what these people were doing, trying to like these two friends of mine going to trying to resolve their medical symptom with non-pharmacological methods.
Yeah,
And in fact part of my family medicine training in Singapore, whenever there was a diagnosis or a problem, we had to come up with non-pharmacological treatment and pharmacological treatment. This is how you would score more points. If you missed out the non-pharmacological part, you won't score very high.
yeah,
So that training was good, but once you're out in the real world, you're like, I don't know, somehow you just forget about the non-pharmacological interventions and you just
yeah,
jump straight here. Take
yeah,
this and take that. Here you go.
yeah, yeah. I'm just curious. I mean, migraine is a very common problem in society today. Um, do you see a lot of patients with migraine, and what do you think is driving or the disease process in something like migraine?
It's very hard to say, Max, because there are a million triggers for migraine, but oftentimes identifying the trigger and getting rid of the trigger really helps. But
Mm.
for most people, it's very difficult to determine what the trigger is. Interestingly, last year I met a lady who came in. She's in her 50s. She came in just to get some blood works done, and she came in a little bit upset, saying that she has wasted so much of money, so much of time, seeing so many doctors and specialists, and no one could help her with her migraine. Guess what made her migraine disappear?
What? What?
Carnivore diet. Carnivore
Cut.
diet.
There you go. So
She went full.
a complete elimination diet of all plant food.
Yes, she went full carnivore. Her migraines disappeared in a week. Full carnivore.
Wow. Wow.
So yeah, and she's not changing her diet ever again, right? So she just came in, got her bloods done. She was really metabolically healthy, and she said, "Yep, see you in a year's time." And
Yeah.
yesterday, I got this new patient who came in to also get some blood works done, and she's having like 2, 3 episodes of migraines every week.
Wow.
And she also came to get a script for immigrant, and and she said she wants like some 20 repeats on it, right? And I said that let's help identify your triggers.
Yeah.
So I gave her all these various options, and she's already on a ketogenic diet, so she was pretty open to going carnivore for about 4 weeks,
Yeah.
and to see if that helps with her migraines.
Yeah. Incredible. And what do you think about the carnivore diet or an animal-based diet is improving the symptoms for migraine sufferers? Is it blood glucose excursions? Is it plant toxins? Is it refined additives to standard carb-based foods? What about it, or is it a constellation of all those factors?
I mean, Max, I mean, we don't have any clear indication what really the trigger is here, but all those things you mentioned are possible reasons, like the plant toxins, because all of us are unique, right? So, I could eat some broccoli and get a migraine, and you could have a whole ton of broccoli and not feel anything. So everyone's unique, but nevertheless, we can't dismiss the impact of plant toxins on our health. Then we have all these processed foods with preservatives, colorings, flavorings. I have a patient whose migraine is triggered by artificial sweeteners, right? So it's really interesting. But I think if we go full carnivore, uh, a lot of these triggers are eliminated. I've never come across anyone who said I eat beef or lamb and I get a migraine. No.
Yeah. Yeah. I
Yeah.
mean, that's fascinating. And the other look, I'm just thinking about possible triggers. There is some evidence of magnesium, B vitamins in supplementing, low level evidence of improving migraine symptoms. So by going carnivore, not only are you doing what we just mentioned, which is removing processed food, removing plant toxins, removing high blood glucose excursions, removing high insulin, but you're also flooding the system with all these bioavailable nutrients. You're flooding the system
Yes.
with bioavailable B vitamins, with magnesium, with iron. I mean, it's elegant in its solution, but from a dietary point of view, that makes sense to me.
I certainly agree. I mean, for me, a nice juicy steak with fat around it is gold. It's gold. You're providing
Mm,
your body with all the nutrition it needs, all the nutrients that
mm,
in there, and it's bioavailable. That's the
mm,
important thing. It's bioavailable.
mm.
So while you can have like a lot of vitamins and minerals in plants or vegetables, they are not readily bioavailable.
Yeah, or
So it's
supplements.
still not really helping you. Yeah, supplements do. No,
Yeah,
they're not really that bioavailable.
yeah, and that's such a critical point, and it's one that I believe we have to help patients, educate patients about, and one that isn't in. I don't think it's properly communicated with when people are told about the vitamin content of different foods. They basically equivocate. Spinach or lentils has the same iron as red meat, or the messaging implies that much. Whereas there is orders of magnitude difference in the value to your body of consuming heme iron from red meat, from liver,
Yes.
compared to eating a cup of boiled lentils. Most
Yes.
obviously because it's in that form of heme iron, it doesn't contain all these digestion inhibitors and anti nutrients. So that I mean, it's fascinating, and I wanted to ask you because you mentioned to me that you are treating more and more patients with a carnivore diet. What other conditions have you found that people benefit from removing plants?
Okay, so the couple of patients I have who have done this, most of them have done it to lose weight, and they've been very successful at doing that. I've got a handful of patients have done it to keep their diabetes in remission.
Yeah,
Most A handful for migraines. I think I've got about two patients that have done it to keep their ulcerative colitis in remission.
yeah,
I've had several do it to reverse psoriasis or put psoriasis in remission.
yeah,
So they are not using all those topical steroids to control their psoriasis. What else? Yeah. Yes, and some and a lot of them have done it to improve their gut health. They say, I'm not bloated anymore. My reflux has gone away. My hiatus seems to be quiet. Yeah.
and I mean, do you have any idea about why or what the mechanism is, why we're getting such a universal improvement in health status on a carnivore diet? Again, is it similar to what we talked about with removing plant toxins? And do you have any specific ideas?
I think it's basically we are removing food that aids and promotes inflammation.
Mm.
And we know that a lot of disease processes in the body is brought on or triggered by inflammation.
Mm.
And and inflammation can be triggered by processed foods and all the additives there,
Yeah,
plant-based diet, smoking, excessive alcohol,
yeah,
artificial sweeteners. So yeah, getting rid of all this in your diet, yet eating food which is rich in nutrition. So you're not depriving your body of any nutrition,
yeah.
and allowing the body to heal or fix itself.
Yeah, yeah, and I mean, I've heard some stuff out of the interesting work out of Paleo Medicina group, and their mechanism is of it basically reduces your intestinal permeability. So for everyone, there's a layer of mucus that sits on the inside lining of our guts that protect the body itself from the bacteria and the everything in the environment that is sitting in the actual gut. And when we're eating a lot of plant foods, they're containing substances that, like lectins, that basically interfere with our body's ability to maintain that mucus lining. And then you got to think if they're complexed or with herbicide like glyphosate, which is in all kinds of wheat, almost a ubiquitous food additive, you can see how that mucus layer gets even more eroded, and then bacteria come in contact with our gut layer. We get inflammation, and then disease manifests. So I think, in my opinion, the carnivore diet is working so effectively because it's really allowing people to heal that gut, and once that gut is
Yes.
healed, then all these downstream health effects from a disturbed gut microbiome and from gut derived inflammation just go away.
Yes, I, I, I mean, I don't have evidence for this, but I like to think of it this way. Our gut has been designed by the food we consume millions and millions of years ago, so providing our gut with the food it was uh, designed for really helps.
Yeah,
Yeah.
exactly. And
So yeah.
yeah. Yeah, no, and if we were designed to be eating a heap of uncooked vegetables or even just general a lot of plant matter, then we would have a rumen, we would have multiple stomachs, we'd have a very long colon for digesting um, all the cellulose, but we don't. We have
Yes.
a very short small intestine, and there's good evidence that the evolutionary trade-off was made for colon length
Mm.
that enabled our to shorten our small intestine, absorb animal foods, and then obviously grow a very big brain to do the
Yes.
kind of higher cognitive functioning that necessitated our rise as the apex predator. So, yeah, I mean, the gut is key, and healing the gut, I think, is a very, very, very good strategy and a universal strategy to improving disease.
Certainly.
Mm. Um, and in terms of your fasting, and I just wanted to make this aside because bone broth, particularly, which is rich in collagens, which is rich in glycine, which is rich in proline, is particularly helpful for healing the gut. Do you ever recommend bone broth fasting at all in your protocol?
No, that is something I've not done yet. I like to keep things very simple with my patients because I understand this whole concept is still quite new to a lot of people. So when
Mm.
it comes to intermittent fasting or time restricted eating, what I tell my patients who want to do it is skip breakfast, just have lunch and dinner, or just start off with having lunch and a breakfast and lunch and skipping dinner. You just try it out
Mm.
like once a week, twice a week, and see how it goes for them.
Yeah.
And but apart from keeping the fasting protocol simple, I don't do much else. So yeah.
Um, in terms of practical, we talked a lot of theory and about metabolic health and the low carb approach. In terms of practical things, so patient or someone might be listening to this and say, I get migraines, or I've had psoriasis, or I have bad gut or gut symptoms. I'd like to try the carnivore diet. What
Mm.
would your recommendation be for someone who isn't on medication but is just curious and open minded and wants to try this approach?
So yeah, I mean it's quite simple really to go on to a meat based diet, and the easiest one would be like just replace your breakfast with bacon and eggs, and that will keep you full for the rest of the day. And when it's evening or dinner time, just have steak and steak and some butter, and that's it. Just try doing that for several days and see what happens. But when you're doing something like that, you have to make sure that you're adequately hydrated and you're getting enough salt in your diet, because once we eliminate processed food from our diet, we're not getting much salt, and salt is essential, right? And one common mistake I come across people committing is eating healthy and forgetting to add salt to their diet, because uh, that can result in some of the side effects like cramps, sluggish bowel movements, headaches, migraines, and it's quickly fixed by asking them to have more water and salt.
Yeah, definitely. And there's physiological reasons as well. I mean, insulin, the hormone, is has a role in maintaining the sodium reabsorption in the kidneys. So, yeah, definitely great advice for anyone practically starting out is to make sure they're having a good quality salt in their diet. I want to make a comment too about the carnivore diet in terms of sourcing our food, because it's my opinion that if we are consuming an animal based diet, predominantly of animal foods, it's our duty to be only sourcing, or as much as possible sourcing, animals that have been raised ethically, that have been raised humanely, that have been fed a nutrient dense, a species appropriate diet, and have had a very quick and painless death. I think that's the bare minimum that we should be doing if we're consuming another creature. So, I mean, in my podcast, I've interviewed a couple of farmers, and I've got another few lined up, and I'm really passionate about spreading the word about regenerative agriculture, and particularly grass-fed, grass-finished beef. Do you have any? Do you recommend your patients do the same, or have you got any specific thoughts on that?
Max, I completely agree with you, and you said it very well. Animal welfare is important. So, when we say that, I am on a carnivore diet, exclusive meat-based diet, and I don't take animal welfare very lightly. It's very,
Mm,
very important for me.
mm,
So, like in Perth here, I know who my butchers are, and I know several cattle farmers, and I've been to their farms. I've seen
mm,
that they are very passionate with what they do, and they are also it sounds ironic, but they are animal lovers. They care a
mm,
lot
mm.
for for their cattle and herds, and I always recommend my patients, if they're going to be on a animal based diet, to source for meat that's been raised ethically, and I encourage them to have a relationship with their butchers, and know where exactly the meat's coming from.
Yes, yes. Yeah, I completely agree. And for people who might not be eating any meat, or really just thinking about you know the value, or they might have heard about the value to the health of consuming meat again, I would say really make this a personal endeavor, and really go to a farm, meet the farmer, look at the cows, look at how the animals are raised, and really draw it back down to the local level, and not away from these
Yes.
abstracted concepts about animals being mistreated, and propaganda videos,
Mm,
or videos of factory
yes.
farming. That's not relevant. Really just think about it on a really local level. And I think if you take that approach, you're really able to generate empathy, and really understand, and I guess connect with the source of your food. And I think you just being grateful and thanking the animal before you consume it is part of that. So yeah, I really like that you're on the same page. Sanji, we're coming up to an hour now. I just like to get I tie this discussion up. Do you have any further thoughts about anything we've talked about?
I think what's very important for a lot of our listeners or viewers to understand, that before they embark on doing anything we have discussed, it's very important for them to speak to their doctors, and find out if there are any adjustments they need to make with their medications, because if we don't pay attention to that, then there could be some really unwanted outcomes, and especially if they are on a glucose lowering treatment, sugar glucose lowering treatment like insulin, and medicines like that. So it's very important to speak to their doctors, and sometimes I hear my new patients saying that their doctors were not very supportive of what they're trying to do or doing. So maybe just look around, and find someone who can guide them and help them, and that's what I usually do. I get someone new, just show them what they need to do and what they can tell their doctors, and they go back and see their usual GPs and get things done. But yeah, so it's just try not to do anything and everything without consulting your doctors.
Yeah, great advice. Find a doctor that you like and that understands everything that we've just mentioned, and yeah, walk through the process with them. So fantastic. Thank you so much, Sanjeev, for coming on the podcast. Where can people connect with you if they want to see you as their treating clinician, or if they want to just follow you on social media? Can you give us a bit of information about that?
Yeah, okay. I'm really, really old school, and I really don't like social media. Nevertheless, if anybody wants to see what I do, I mean, I am on Twitter. So if they just look up my name, Sanjeev Balakrishnan,
Yeah.
I'm not on Facebook or any other social media platform.
Yeah.
And I am a GP in Victoria Park, and so I don't want to make it sound like I'm advertising anything. No, it's so if you so if you look me up online, you will know where to find me. But yeah,
Yeah.
that's it.
Fantastic. Yeah. So if any patients in Perth, then yeah, you can go see Dr. Balakrishnan and make an appointment. So fantastic. So thank you so much, Sanjeev, and yeah, we'll talk again.
Sure, Max. Thank you. Thank you so much for this opportunity.
Thanks. Cheers.